Hello, thank you for tuning into Compass Unity TV. On this episode, we will discuss the Strategic Prevention Framework. The Strategic Prevention Framework is the evidence-based prevention planning process that Compass Unity follows in order to prevent and reduce the use and abuse of alcohol, tobacco, and drugs by youth. The Strategic Prevention Framework promotes data-driven decision-making that focuses on population-level change. This change is made possible by addressing both the risk and protective factors that are present within the community. Risk factors are those elements within an individual or their environment that make them more susceptible to certain negative behaviors or conditions. Examples of risk factors are poverty and lack of economic opportunity for young people, having a family history of alcohol abuse, or teens engaging in early alcohol consumption. Protective factors are elements within an individual or their environments that make them less susceptible to those negative behaviors or conditions. Examples of protective factors are close family ties, good communication between children and parents, and consistent community and family values that oppose alcohol abuse. The Strategic Prevention Framework utilizes a 5-phase process and 2 guiding principles. The first phase is the assessment phase, which is when the coalition collects data to define problems, resources, and readiness within a geographic area to address needs and gaps. The capacity phase is when the coalition mobilizes and/or builds capacity within a geographic area to address its needs. The planning phase is when the coalition develops a comprehensive strategic approach that includes policies, programs, and practices, creating a logical, data-driven plan to address problems identified in the assessment. The implementation phase is when the coalition implements evidence-based prevention strategies, programs, policies, and practices. The evaluation phase is when the coalition measures the impact of the Strategic Prevention Framework and the outcomes of its implemented strategies, programs, policies, and practices. Cultural competence and sustainability are the 2 guiding principles that must be incorporated throughout each stage of the Strategic Prevention Framework. Cultural competency is the ability of an individual or organization to interact effectively with members of diverse population groups. Sustainability is the process of building an adaptive and effective system that achieves and maintains desired long-term results. To learn more about the Strategic Prevention Framework, check out the links in the description box or contact your local Substance Abuse Prevention Coalition.